If you've torn your ligaments inside your knee, most commonly you've torn your ACL or the Anterior Cruciate Ligament. That's the ligament that goes right through the center of the knee and stabilizes it. Rupture of the ACL is very common. We reconstruct the ACL now, usually using a donor tissue called bone, patellar tendon bone from a cadaver that we sterilize. And then we can rebuild that ACL as an outpatient arthroscopic procedure. Sometimes rupture of the ACL is associated with damage to the rest of the knee, either tearing the meniscus, which we repair, tearing the posterior lateral corner of the knee, which sometimes we need to rebuild, or sometimes rupturing the posterior cruciate ligament, which we also can reconstruct with donor tissue. Rebuilding the ACL takes very accurate surgical treatment and has to be placed perfectly for it to work well. And it takes a really dedicated rehab program on the part of you, the patient. And if the surgeon does their part by placing it perfectly and you do your part by really doing the rehab program well, these can return you to full sports, the activities that you want to do.